As a resident, I recall asking my supervisor how to treat patients with borderline personality disorder, and he answered sardonically, mockingly, "You refer them." I'm Jamie, I'm a licensed therapist. This is the series, The Dark History of Mental Health, and we are continuing to dive into Judith Herman's book, Trauma and Recovery. Judith Herman is a psychiatrist, and she is the one that brought to the world the idea of complex post-traumatic stress disorder, or CPTSD. If complex trauma is new to you, it is basically the idea of trauma getting endured for a prolonged period of time in an environment where you are not able to escape. So particularly a family environment, a cult environment, and obviously this also can occur in intimate partnerships. There are more environments, I'm just naming a few. So let's continue. When survivors of childhood abuse seek treatment, they have what the psychiatrist Denise Jelinas calls a disguised presentation. They come for help because of their many symptoms or because of difficulty with relationships, problem in intimacy, excessive responsiveness to the needs of others, and repeated victimization. All too commonly, neither patient nor therapist recognizes the link between the presenting problem and the history of chronic trauma. She continues, survivors of childhood abuse, like other traumatized people, are frequently misdiagnosed and mistreated in the mental health system. Because of the number and complexity of their symptoms, their treatment is often fragmented and incomplete. They may become engaged in ongoing destructive interactions in which the medical or mental health system replicates the behavior of the abusive family. So let's say the doctor represents their mom, and then the patient is now reacting to the doctor as though it's like their mother figure. And when the doctor invalidates them, it's mimicking their mother invalidating them. They are likely to receive a diagnosis that carries strong negative connotations. 3 particularly troublesome diagnoses have often been applied to survivors of childhood trauma: somatization disorder, borderline personality disorder, and multiple personality disorder, which is now called dissociative identity disorder. A reminder that all 3 of these diagnoses, she says this, was once under the label of the now obsolete term hysteria. Here's where it gets intense. Patients, usually women, who receive these diagnoses evoke unusually intense reactions in caregivers. Their credibility is often suspect. They are frequently accused of manipulation or malingering. They are often the subject of furious and partisan controversy. Sometimes they are frankly hated. These 3 diagnoses are charged with pejorative meaning. The most notorious is the diagnosis of borderline personality disorder. This term is frequently used within the mental health professions as little more than a sophisticated insult. The psychiatrist Irvin Yalom described the term borderline as the word that strikes terror into the hearts of middle-aged, comfort-seeking psychiatrists.